And now we would like to welcome and introduce Dr. Carmen Dominguez. Dr. Dominguez is board certified by the American Board of Anesthesiology with added qualification in pain management, and she is also a certified medical acupuncturist. So fits right into Dr. Stewart's lecture. Dr. Dominguez graduated from Columbia University Medical School. She completed her internship at Mary Imogene Bassett Hospital in New York and her residency in anesthesiology at Columbia Presbyterian and her fellowship in pain management at Massachusetts General Hospital. Dr. Dominguez has been on staff at Boca Raton Community Hospital at the Davis Therapy Centers since April of 2007. We are very pleased to present Dr. Dominguez to you this evening.
Thank you for coming tonight. And these are some of the topics that I'm going to be touching on. What is back pain? When is it that you're supposed to see a doctor? Because everybody does have pain at some point or another. How do you find out, or how do you help find out to your doctor why are you having pain? And what can you do to relieve it? And what can your doctor do to relieve your pain? So pain is very common. About 80% of Americans do have back pain at some point in their life. It's the third most common reason why you go to the doctor after age 40. Only, only surpassed by arthritis and heart disease. And in 90% of people, the good news is that it's self-limited, meaning that if you do nothing, it will go away on its own, usually within 2 to 6 weeks. You would ask, well, what happened if I have back pain? Does that mean I'm going to have back pain chronically forever? Well, that is not the case. And most people that have back pain once will have back pain again, but not in a chronic basis. When should you see your doctor? These are some of the warning signs. Increasing pain. The pain is very severe, limiting all your activities of daily living. Groin or leg weakness or numbness, and incontinence of urine or stool. And if you do get this last warning sign, you cannot wait a week to go see your doctor. You need to either call your doctor or go to the emergency room to be checked out, because what that indicates is that there's something pressing in your spine. And if you don't take care of it quicker rather than later, you can have permanent damage in the legs. So the most important causes that you or your doctor do not want to miss is spinal infection or cancer. That people that have back pain and have those two problems as the cause of the back pain is very rare or a very small amount. So if you have back pain, that doesn't mean that you have cancer or spinal infection, but those are things that your doctor is going to try to make sure you don't have before recommending other things. Degeneration is the most common reason why people have back pain, wear and tear, just like with the knees. What are the things that can accelerate the wear and tear? Smoking, genetics, and spinal injuries. Car accidents, falls, etc., etc. Back pain can be classified by two categories. Mechanical pain, which is basically pain that is due to wear and tear or degeneration. Symptoms, usually the back pain is due to mechanical reasons, gets worse if you're active, when you move. The location is usually in the back, in the buttocks, or a little bit on the thighs, but usually doesn't go all the way down to the leg. If the pain goes all the way down to the leg, it usually indicates that there is some sort of spinal compression or a spinal nerve is being compressed. And that is usually due to neurogenic pain. So there's a nerve or the spinal cord that is being compressed, and that causes inflammation, and that leads to numbness in the legs, pain all the way down the leg, or weakness. causes of neurogenic pain is some sort of injury to the spinal cord or a specific nerve because it's either being pinched or squeezed. Some of the symptoms, leg numbness, leg weakness, refer pain because you can have pain only on the foot or the knee and don't have anything wrong specifically with the knee or the foot, and it's referred from the spine. Burning or pins and needle sensation and decreased reflexes are other things that your doctor is going to look at during the physical exam to determine what kind of pain do you have. So, what are some of the most specific spine conditions that can lead to back pain? Annular tears, which is basically a rupture or a break on the integrity of the disc. The discs are like a shock absorber, just like the cartilage for the knees helps absorb the shock whenever you walk. And annular tears are usually due to an injury or wear and tear that comes as time goes on. Disc disruption. This is an MRI, and this is a disc. Basically, it's supposed to be like a oval or a circle, but you can see here that it's deformed, and that is due to inflammation or some wear and tear also. The disc can be first deformed, degenerated, and then it can fully herniate.